But actually, I am here to tell you that a systemic review of Endocrine Society has confirmed that adrenal fatigue does not exist.
Oh my goodness. It does not exist. Hi, Dorothea. How are you?
I'm good. How are you, Orla? You looking fantastic this morning.
Oh, you always do. Absolutely. And I love speaking with you because I think you really break it down simply in a way that cuts through all the mistruths and misinformation that's out there. And I'm hoping today you might answer a few questions from me because I've heard something thrown around called adrenal fatigue. And I don't know if it's a buzzword or if it's an actual medical term.
So adrenal fatigue has been a buzzword for a while now, especially during the COVID pandemic. It's been in usage even more so. What would you say? Three things that come to your mind if you think of adrenal fatigue? What would it be?
Stressed out, burnt out, emotionally overwhelmed. That's, and I know the adrenal glands. For me, from my days in school, it's like the fight. I always remember these words: fight or flight. The adrenal glands. So it seems like that if I'm stressed, my adrenal glands are working extra hard, and they can only work extra hard for so long, and then they just burn out. Then you have adrenal fatigue. That's my layperson's understanding of it.
Sounds good, right? It looks good, it sounds good, but it's not always right. And the part of it is obviously true that it's our sympathetic nervous system that is responsible for the fight and flight reaction that then leads to increased secretion of of cortisol and adrenaline. But interestingly enough, it does not always correlate with the acute stress or stress situations that we as people define it in our environments, whatever physical stressors or mental stressors. The studies have not confirmed that there is a direct correlation with the levels of cortisol that are being secreted. So the term of adrenal fatigue has been proposed, I think, in the 90s by a chiropractor and has been around ever since. But actually, I am here to tell you that a systemic review of Endocrine Society has confirmed that adrenal fatigue does not exist.
Oh my goodness. It does not exist.
Does not exist.
So, really, you mentioned cortisol there and adrenaline. What's the difference between both of them?
So adrenaline is the flight and fight hormone, where cortisol is more responsible for stress reaction to blood pressure regulation, regulation of your glucose levels, and many other processes in the blood. So that there are actually very two different hormones that are responsible for many different things. And actually, the term of adrenal fatigue is really misleading because it can cause a delay in diagnosis in patients who really have adrenal problem, meaning adrenal insufficiency, where there is an adrenal problem or some other problem that is leading to a low cortisol level, which is life-threatening.
Oh, really? Oh my goodness. So there are measurable levels. So you can get your cortisol and your adrenaline levels measured in your blood and compare them to what's deemed normal level. Is that right?
So adrenaline is not commonly a parameter that we actually measure because there's no consequence, there's no good validated methods to measure it, and there's no consequences that we would act on, nothing we would act on depending on how high or low the level is. The cortisol levels are being measured, and they are being measured in your blood. And because cortisol is another hormone that undergoes a circadian rhythm, meaning the levels are the highest in the morning and they drop around midday afternoon, they start dropping. So that's why it's really important the timing when you take your blood test to check on the cortisol levels. It must be early in the morning, but because that's why when the cortisol secretion from the adrenal gland peaks around 1 hour after getting up.
And you're saying cortisol is associated with stress, is it?
not really associated with stress. So what we know, so basically the common thinking, like I have lots of stress, my cortisol levels are high. It's not simple as that. So there's no direct association with one's perceived stress level and your cortisol level. But what we know now, that is an example that sleep deprivation can cause you to have higher cortisol levels in the afternoon or at night, which can, of course, affect your metabolic health, increase your blood sugar levels, and impair your metabolism greatly. And also, what we know is that patients with depression seem to have high cortisol levels at night as well. So this is what we know. That's what the science has confirmed. This association is really confirmed when it comes to high cortisol levels. In other circumstances, there are plenty of cortisol measurement methods that are really not validated, where cortisol levels are being measured late in the afternoon, once off measurement, or the saliva, and then the patients are being put on hydrocortisone therapy, which can cause more harm than good, because there are plenty of side effects of supraphysiological hydrocortisone therapy in order to treat presumed adrenal problem where there has been none to start with. So what I'm trying to say, if you suspect that you might have adrenal problem, call it adrenal fatigue, or you're just feeling tired, you're losing weight, you don't feel as vibrant as you used to, I think it's a good reason to come for an endocrine investigation and have it tested properly. Adrenal gland disorders, meaning low cortisol secretion from adrenal gland, is still quite rare. But if it occurs, it has to be investigated very thoroughly and very correctly. And the treatment has to be guided by an endocrinologist in order to really restore the basic function and the functionality and vitality and vibrancy of the patient, rather than cause more long-term damage with a therapy that the patient might not have needed and to start with.
So really, what you're saying there is the lack of vibrancy and vitality, maybe disturbed sleep patterns and all of that, that they really could potentially be the first signs that your adrenal glands aren't working properly.
There are, of course, those signs are very non-specific, right? Weight loss is also one of those signs. So undesired weight loss could be anything, as we all know. I think if you start losing weight, the first thing you think of is cancer. So there are many, many causes that can end up with the same symptoms. So the symptoms are quite non-specific, but if you had seen your GP and there's nothing to be found on the assessment done by a general practitioner, and you feel off and you don't feel like you're performing as you used to and you lack energy, then I think it's time to come and see an endocrinologist.
And is it easily treatable?
Definitely is easily treatable. So we treat it with hydrocortisone tablets, which are then taken if the diagnosis of adrenal insufficiency is the word for it. So low cortisol production from the adrenal gland. Treatment is lifelong.
Oh, so you're on it for the rest of your life.
Yeah.
That's it. That's interesting. So it's not something that you just need a top up and it'll regulate itself. It's something you're on it.
Yeah. Yeah.
And
The problem, sorry?
so how long then does it normally take for you to start feeling the benefits? Is it a few months or is there ever times?
Immediately.
Oh, immediately.
Yeah.
Oh, that's fun. So it seems like a very simple remedy then, really, isn't there?
Yeah, it is. That's why it's really important it is a simple remedy when you know what you're treating. But then if you are being treated for adrenal fatigue, which doesn't exist, for low cortisol level, which you don't have with a cortisone, that doesn't really treat any of those, because you don't have any of those, then you can't expect any great improvement. In fact, it can do more damage long term than it will benefit you. So I think what I'm trying to say, if you have a real problem with your adrenal gland and your adrenal glands are not secreting enough cortisol, it is important to have a specialist, endocrine specialist, diagnosing you, treating you, and having a regular follow-ups with them as well.
Correct me if I'm wrong, the adrenal glands, do they sit on the kidneys?
Yeah, absolutely.
So if somebody has actually kidney problems, or does that affect the adrenal glands, or is it just that their physical location is there, but they're not impacted by the actual workings of the kidneys?
A great question. So it's just the location and the one kidney function. So the impaired kidney function won't affect the adrenal gland in any way.
Because I heard somebody saying to me, where people talk about body detox, I'm detoxing my liver and I'm detoxing my kidneys, but that really doesn't affect the adrenal glands. It's not going to affect, that's not a cure, basically.
No, not really. Not at all. Not at all.
Oh, that's just another myth there we just busted on adrenal fatigue. So really, isn't it? You know,
Yeah.
yeah. Thank Dr. Dorothea, thank you so much for clearing up those questions I had there, because I know there was a lot of information, and it's great to know that first of all it's very, very treatable, and also to know that there is no such thing as adrenal fatigue, but that you do need to get it looked at, because where things go wrong, cortisol really is having problems with your cortisol levels in your blood. Is it cortisol or cortisone?
Cortisol. Yeah.
Yeah, that actually could be life limiting. That's really serious if you tend to ignore that problem, really, isn't it?
Absolutely. Absolute. Thank you for your great summary. I think you nailed it. So if you really have a problem and your adrenal gland is no longer secreting enough cortisol, it is a life-threatening condition. So whether you want to label it adrenal fatigue or whatever you want to label it as, if you feel that you're feeling off and not as usual, and your general practitioner has ruled out all the internal medicine stuff, please do come and see an endocrinologist for further evaluation.
Thank you so much, Dr. Dorothea. And what would you like to say to our listeners here today?
So thank you for tuning in, and please bear in mind this is all for educational purposes. And if you require endocrine consultation, please seek help of an endocrinologist. If you like what you just saw, please hit the subscribe button, and there will be more information down below. Thank you.
Thank you.